So, like I said, I am from Madison Health over on the east side of the state. I'm an RN, I'm an oncology certified nurse, and I'm also an American Cancer Society Lion credentialed navigator. So, we'll talk a little bit about that as we go. You can advance to the next slide. The NCCN outlines six key components of survivorship care. And as we look at these, they can be kind of overwhelming for one person to take on. So the question is who is doing this and how do you communicate between each other? You can go to the next slide. Today we're going to talk about the experience of a growing cancer care organization, and starting with building a multidisciplinary team in your organization and building a case for navigation so that both time and resources are set aside in your organization, and building a team outside of your organization, and then empowering self-advocacy in patients and caregivers. You can move on to the next one. So we're in the southeast part of the state. We kind of reach in a 25-mile radius of our hospital. We have a population of about 75,000 people, but about 22,000 of those are students at BYUI. So we have that really young population, and then we reach all the way 150 miles to Salmon and get patients from there. We go 100 miles to Ashton or 80 miles to West Yellowstone. So we really reach the rural parts of the state. And so it's just, we're a growing center where we used to have an oncologist come once a week up from Huntsman and staff our clinic, and now we're growing. So like most of you, you can go to the next slide. We overlap with a lot of other systems. So we overlap with our affiliate in Utah, but we overlap with other major health centers in different parts of the state. We're one of 9 county-owned hospitals in Idaho. And sometimes just the care gets very complicated and providers are reaching over state borders. We're kind of just juggling patients in between getting care or labs or services closer to home, but still trying to take care of them the best we can. So coordination can get really complicated. You can go on to the next slide, that's fine. Provider education and trust is first and foremost, and we have great providers that do that, but they can't do all of it alone. And so that expands to other people, and there's lots of social workers and dietitians I see on Echo today. So this will really reach out to all those other disciplines that are helping. We are expanding our survivorship program beyond our just current situation. Requires strategic planning and buy-in from the bigger organization. There has to start with an engagement of the stakeholders that want that expansion and a champion to kind of move that forward. And maybe you're that person because you're on this Echo Idaho today. So I want to share kind of how we progressed through, excuse me, past just being a provider base to expanding that to other multidisciplines. You can go to the next slide. So this is kind of our base team. We started with an oncologist and a PC and an NP. We also had a registered nurse that transitioned. I transitioned from just a registered nurse to a nurse navigator, and we had a patient care coordinator. But there wasn't a registered nurse on the team for quite a while. It was just the oncologist and patient care coordinator, or in other words, some people call them the unit coordinator or unit huck or whatever. But there were other resources within our hospital that were there, but we weren't using like we could. So we really petitioned the hospital to dedicate some time from a social worker and from a dietitian to the oncology department. We also kind of petitioned them to hire a financial navigator that is actually under the umbrella of the pharmacy department. Once we got this, an opportunity came up with the American Cancer Society for all of us, 5 of us, to be credentialed as navigators. And this is a wonderful program. This really helped us build a team within our organization so that we were all on the same page. We had some more education so that the financial navigator, dietitian, social worker knew a little bit more about cancer and the resources that were available. And it also put in place some processes of communication between us so that we were just better at helping both cancer patients and survivors through the whole process. Go on to the next slide. Navigation isn't just nurses. It's really about improving the patient experience in cancer. It just has made all the difference for us, just to eliminate the barriers of care for those patients. It doesn't come without that allocation of time and resources in the hospital, though. Go ahead and move to the next. There is an important case to be made in the hospital for building more navigation. This is a slide coming from the ACS Lions program. It's part of the toolkit to help if you are needing to petition for more time or resources in your hospital. They have a toolkit online, and it helps you work through the steps of making a case, gathering data, just kind of proving that, yes, we need this, and we need it for several reasons in our hospital, not only for the benefit of patients, but for the benefit of the health of the organization, and also just for satisfaction of the employees and staff there. These are all great reasons. So I'm just going to go through these 6 that are so great. Improve patient outcome and home health equity, enhance care coordination and operational efficiency, cost savings and revenue growth, increase patient volume and retention, staff satisfaction and commitment to equity, and quality incentives accreditation. You can go ahead to the next slide. So this is in the chat. I've put a link to where you can access the American Cancer Society Lion program. It gives you a toolkit. It gives you a step-by-step help. When we did it, it did cost $500 per person, but we applied for a grant. But now it is actually being made free. There's also a flyer that Jana Gherkin from the American Cancer Society sent me within the last month that this program is free, and for any organization to help you level up your navigation team in your hospital or wherever you may be. It is a great program. Jana is on the call today, I believe. I haven't seen her, but she said she would be on until 1 if anyone has any questions. Her information's also in the chat. So she's a great resource and helped us tremendously through the process. So I don't know, Jen, are you there?
Yes, I'm here if you can hear me.
Okay, do you want to just say anything that I didn't mention about the Lion program?
I mean, I think you covered a lot of great stuff, but yes, it is free now. That was a change that was made across the board, and so that's great. So it makes it really accessible to everyone, regardless of a cost barrier. Um, if there's a way we can share, I don't know if we can share out the flyer with whatever notes might come after the meeting or anything like that. I don't know if I can post the flyer in the chat. I'm not so sure if that's an
I
option.
I believe the flyer is what I just posted. I think,
Okay.
Karie, you had given me the flyer and you can
Yeah.
open that and make sure. I think it's what you're talking about.
Okay. Well, great. Well, you can also reach out to me, and I'm happy to share it with you too if you miss it there one way or the other. But yeah, thank you so much. It's a great thing to take advantage of if you have an interest in kind of furthering the navigation, kind of skills across the board for everyone.
Yeah. Thank you so much, Jana.
Yeah.
We can move on to the next slide. So, in 2024, the physician fee schedule from the Centers for Medicare and Medicaid Services included reimbursement for patient or professional non-clinical patient navigation. So, for the first time, there's a reliable reimbursement pathway to support the navigation workforce. So hopefully that can help you in your plug to get just increase the level of your navigation in your system. Let's go to the next slide. So just one aspect of that is our financial navigator. Just to put out some numbers out there, last year he was able to acquire $142,000 in copay assistance and $730,000 of free drug. So there are resources out there if we're connecting to them. All right, let's go on. Oh, I'm sorry. Let's go back to the last slide. One thing I wanted to mention on this is that part of this process really helped us to pin down our processes on how we communicate, including sharing kind of our pre-clinic summary sheets, um, we have like a roundup sheet. We can prepare for needs better. We are better at crisis triage because we're sharing the load. We're clarifying our needs and our roles. And we are sharing that with patients. So there's a lot of education on the resources they can gain within our own team. So it's helped us in communicating as a team and to the patient as well. It also we're currently trying to get COPI certified, which is the Quality Oncology Practice Initiative. And a lot of these systems are dovetailing right into that certification. So, all right, we can go to the next slide. Beyond that team, there's so many people in-house assets that you don't want to forget about. The pre-authing and scheduling people, physical therapy, radiology, lab, pharmacy, surgeons, ER, management, other providers, the infusion nurses, IT, marketing, the foundation. One where we're really working on right now is beefing up our survivorship care plans with IT so that it's not a manual process, but it's more of an automatic process. And having them on board is making all the difference. Marketing is really great we're teaming up with them to do more annual events for cancer education rodeos, but also including Cancer survivors in that, they can share their story, they can invite their families, they can celebrate, they can reconnect with the caregivers that have helped them through their journey. They've had women's night out, a lunch and learn. They contribute to t-shirts, to interclinic stuff, to the foundation also helps us with gas cards. A lot of survivorship things that we can't quite reach is one person in the clinic. So think about your other resources to building your survivorship team in-house. All right, let's go to the next slide. So these are some crucial people outside of the organization, and this is one of the places that survivorship care either shines or it kind of quietly falls apart. Coordination outside the treatment centers where patients feel either held or they feel lost, especially 1 year out or 5 years out. And in all these situations, communication, it comes down to communication. Let's go to the next slide. Here are some things to strive for. The survivorship care plan is the anchor, and it needs to be a living document. It's not static at discharge, and it needs to be shared with every outside provider and with the patient. Good provider notes include a plan for survivorship. Even if there's not a survivorship care plan, there should be some mention of that with the provider. If there's a designated survivorship care coordinator, that can be a nurse navigator, it can be a survivorship NP, patient care coordinator, or social worker, or really anyone that's willing to take it on. It's usually the person that's the point of contact for the outside referrals, follow-up and tracking, and care escalation when symptoms cross disciplines. Some ways in that shared communication pathway are, of course, digitally in Care Everywhere or Epic or Cerner or wherever you're going to put it. Secure messaging in your referrals and feedback as you're sending referrals and feedback, and kind of sometimes we have to go back to the just fax and follow up phone protocol is better than nothing, and that's sometimes just where we're at. And then with the patient, with a paper in hand so that they know what's happening. Set clear expectations. The survivorship care plan should set clear expectations if things escalate, kind of the if then. If there's new pain, who is the patient going to go to? Are they going to go to PT or oncology? Are they going to go to their pain specialist? If they have abnormal labs, if it's done by a local lab, are they going to send it to oncology? If they have a mental health crisis, where are they going to go? If there's side effects, what are their resources? Are they going to the ER? Are they going to a provider visit? They need to know kind of if then what would they do if something cropped up? Empower primary care providers and specialists without overwhelming them. The survivorship summary should be 1 to 2 pages max, and it should clearly delineate what oncology is managing and what PCP or specialists are managing. But let them know that we're open to oncology consults if there's a red flag. Annually kind of review that, even if we don't see them. Have warm handoffs, not just referrals to specialists, and ask the patient, have you seen anyone else since you've been here? Or have you had or do you need any new lab scans from your provider or your PCP or other providers so that you can consolidate care? All right, let's go to the next slide. Often we discount the most important team member is educating and giving the patient the confidence and knowledge that they need to be an advocate for themselves. And this often takes asking and explaining in several ways and several times, being consistent, returning calls, acting on requests, building that relationship of trust. Build in processes at every milestone. So, like every time they come into the clinic, review the care plan, um, asking the questions: Have you had anything done? Do you have any questions? Kind of at milestones, like also when they finish treatment, when they are having follow-up scans, just say, I'm going to check with you in this is when we're going to touch base again. Even if they don't have a provider visit, even just having a reminder to do a phone call follow-up. Empowering patients and caregivers with education, timelines, tools, and kind of giving them the right to be advocate for themselves and not so much codependent on us. And really everything, improving communication is just keeping at it. So, all right, let's go to the next slide. Now that we've kind of talked about the closest organization within our hospital and then out to those primary care providers and to the patient, I want you to think just a little bit bigger into the state of Idaho. The Comprehensive Cancer Alliance for Idaho is working to update our state cancer plan. And one of the action steps that Amy Sheff proposed as part of our work is refining an online Idaho directory for survivorship support programs and resources. And I suspect we're going to have more conversation about this in the upcoming year, and I'm not sure how permanent the existing resources will stay, but the goal is to not only have a limited number of people using it or contributing to it, but to have all of us, and all of you are kind of part of that. The link to this Comprehensive Cancer Alliance for Idaho website is in the chat. And there's this is a picture of the homepage. On the resources drop down, there's a quality of life resources and events link, and it will take you to a Google sheet where we've started this resource page. And it's got stuff all the way in all parts of the state, and it's differentiated. I wonder if, Lindsay, you could share a picture of the tab or the Google sheet.
How about I'll just pull it up. I have
Okay.
stop that share.
So it's differentiated into like events or online things. It has a place to put a link. It has a place for whoever's contributing or a contact name. It has a place for dates. It's really just simply a Google sheet. But as we're building this, I just ask that each of you who are on the call today think of what resources you have. And if you could contribute 3 to 5, we would love that. There's even a few that I've seen today or in the last few days that I'm like, I need to add those. As you can see, there's all kinds of stuff. So as you're working through, the situations of your unique patients, you can go to the sheet and think what could help them, or or you may know of things that in your area that could help someone else. I think we can go to the next slide. Just as a wrap up, build a multidisciplinary team in your organization. There's lots of resources to do that, and build a case for navigation and look outside of your organization and empower your patients. And I'm open to any questions that anyone has.
Great. Karie, thank you so much. Did you want me to pull up those other websites to share? Or did you
I
cover it all?
think they're okay. The one website is just the ACS Lions that they could find out more about. That's in the chat. So
Great. Libby, I see you have a question. Thanks.
Yeah, I was just wondering if you had a template for your survivorship summary. I know you mentioned keeping it short and sweet, love it. Usually we just send chart notes out, and then to try to read all of that and put it all together is definitely difficult. I don't know if you guys do that as a team effort, if you work together to create that, or if everybody adds their own piece. Do you have some kind of a template for that?
yes, there are templates. They're through the NCCN, and they are for they kind of have every template for every major cancer. I'll try to put that in the chat as soon as I pull it up.
Cool. Thank you.
And I know that we're going to address that more in upcoming ECHO sessions. So let me see if I can find them. And this is where we're really trying to get a little bit better. So we are definitely kind of just trying to initiate this. And this is the piece we're trying to get in our EMR so that it's a form we're filling out in the EMR and it stays there. And then we're hopefully reviewing it every time the patient's coming back in and just saying, okay, what's changed? And here's a new copy. But good question. I'll look for that and see if I can find it.
Great. And what other questions do we have for Karie? Well, Karie, if there are more questions, we can use the chat for that as well.
Okay.
Just really appreciate you kind of bringing us through your journey of moving as a clinic and to provide really good care. And I think it's a great story of how this can look in rural Idaho. So thank you so much.
There's hope for small clinics. You can do it.